art. Now, let me tell you about the next day after my surgeries. On Tuesday morning, I got up, I went into the bathroom, I took my own shower, I walked down to physical therapy. And you cannot know what a great experience that is unless you've had to be pushed someplace in a wheelchair and wait for elevators and all of that. I worked individually with a physical therapist, and then I went to the ballet bar and practiced bending my knees, and I could see in the mirror how far I was going down each time and go down a little bit further so that I was getting more flexion in my knees. I was able to get on the recumbent bicycle and do complete revolutions the very day after my surgery. I was able to practice climbing stairs in the physical therapy and getting out of a car. I was thinking as I was coming down these stairs, well, this is a good entree for somebody who's had knee replacements to walk down 8 or 10 stairs in front of everybody. And when I was finished, I walked back to my room. I had had my whole knee replaced the day before. If you are a knee replacement candidate and you don't know the word flexion, F-L-E-X-I-O-N, get acquainted with it because it's a very important number for you. What you're striving for is 120 degrees of flexion. I believe I left the hospital with 120 degrees of flexion my second stay. I haven't said anything about pain, and the good news is that I don't remember much about pain. And yet that was my greatest fear when I was at the stage where you are now. I knew going in that I was allergic to the ingredients in pain medicine and that I was going to be limited to taking higher than average doses of ibuprofen. But the practice uses a long-acting spinal anesthetic which somehow magically allows you to walk but not feel pain so that you get flexibility and mobility before the anesthetic wears off. I want to emphasize something very important here. Do pre-op exercises. I did not understand how important those were with my first surgery. I did with my second. A lot of muscles are cut when your knees are replaced, and the more muscle strength you have going in, the more you will have later. Megan is going to talk about the program later. Listen to everything that she says. Going home and rehab. Two things I didn't need that I thought I would. A rehab center. I wanted to go there. Dr. DeGioia wisely vetoed that. And I didn't need to sleep in the family room on the sofa bed as I had expected because I was able to walk up the stairs and down. The next morning I came down, made breakfast for my husband. He went to work at 5 o'clock in the morning. I can't say that I was 100%, but I was a whole lot better than I had been. And I met many patients in the hospital who were going home to live alone after their hip or knee replacements. So that is an option. I say this to people when someone says, well, what if your insurance will not pay for physical therapy? I say, if you spend money going to movies, getting your hair done, buying cigarettes, going out to dinner, divert that money to buying one or more physical therapy sessions for yourself because that's going to be your ticket to the life that you want to live. And for those of you who are on Medicare, check with your Medicare supplement insurance policy because most of them have a free membership to some facility. Like I've used Alexander's Athletic Club for years, and they have Highmark Blue Cross has a Silver Sneakers program there. AARP does the same. My 94-year-old friend who lives in California, as a result of my telling him this, got signed up at a Y. By the way, he still works as a house painter every day. But at those programs, you will learn balance, coordination, and strength training, and all of that will help you build up your muscles for your recuperation. Sorry, my vocabulary left me. Okay, life with my new knees. First, I have a life. 14 months after my second surgery, I was able to take a 14-hour flight from Chicago to Shanghai for my dream trip to China, which I had to postpone a few times because of my knees. 2 weeks later, I was able to walk for 4 hours in the Forbidden City, sitting down only one time. I was able to get a new bike and ride it. And I want to say one thing about a bike, because if you enjoy biking, you might want to look into this. Bikes have been redesigned to take care of us boomer people by putting the seat and the pedals a little bit further apart so that you have about 4 or 5 extra inches to move your knees. Now, I didn't actually need that, but it would be useful for somebody. As Dr. DeGioia said, I was able to go back to my professional life of freelance writing and speaking, going all over the country, teaching personal growth classes based on brain research. Since February, I've been in something like 14 states, from New York and New Jersey to California, Oregon and Washington, several places in between, climbing up and down train platforms, high escalators in subway stations, carrying luggage, dragging luggage. But the most important things are the activities of daily living, the things that you really don't even want to do until you find you can't do them. And most of all, I have my first grandchild, Addie, who's 3 months old, and I can carry her up and down the stairs. I would encourage you to think about these questions for recovery. What do I want to be able to do after my hip and knee replacement, and what do I have to do to make that happen? And after replacement, people have told me some of these things, that they've resumed their daily life at home, they've gone back to work, some very strenuous works, resumed or taken up tennis, golf, street and mountain biking, snow skiing, water skiing, traveling, and Fred Thompson, whose name was on our patient advisory council, is learning the tango. People are doing whatever else they want to do.